Making that decision to increase your GLP-1 medication dose might be the worst thing you could do in your lasting weight loss journey. We've helped thousands of patients with this exact scenario, and the ones who implemented our plans found the success that they were looking for. My name is Dr. Jones, and I have clinics that service across the nation. I work with my medical practitioners, and we specialize in helping our patients achieve lasting weight loss with an emphasis on utilizing microdosing and lower dosing protocols with GLP-1 medications and powerful peptide therapies. I don't think anybody really has it dialed in the way that we do because, and I've made plenty of other videos talking about this, but I don't think GLP-1 medications are being used correctly. I think people are getting wrecked by side effects. In fact, this very video is sort of related to that, right? Maximum dose, what do I do? But I think the way that you need to go about this is really just switching the framework of how you look at GLP-1 medications and looking at them as a tool rather than the solution. The problem, obesity, you also have to understand that while many believe it's a chronic and irreversible disease, that's just not the case. Many people understand that it is impactful, that it is a big deal. It is chronic and it's progressive, but it's not irreversible. Right? And I think if you have that framework from the beginning, it really changes the narrative of what you think is possible and how you're even willing to approach this. In summary of all that, if you implement proper lifestyle interventions and you get the aid of these tools, the GLP-1s, the powerful peptides, you're gonna get better results and you won't need to use as high of the dosing. And we'll come back to that, right? Because that sort of, is gonna relate to the solution of what we're talking about. But right now, you're watching this and you're probably a little pissed off because you're at the maximum dose, 15 milligrams of tirzepatide, maybe 2.4 of semaglutide, or you're damn near the maximum dose, right? With nowhere to go. Maybe you're still losing weight, but it's starting to slow down and you're panicking. You're probably already stalled. You're probably in freaking zombie mode. And if you guys don't know what zombie mode, this is what I refer to as the situation where you are brain fogged, tired, constipated, feeling cold. Your body is very achy. And of course, you're not losing weight. This starvation mode is a literal down regulation of the metabolism, right? Your thyroid output literally slows down. And because the thyroid output slows down, you manifest these symptoms, the weight loss slows down, and this is all happening because you're starving. And starvation mode, you'll definitely have to check out my other videos to learn more, but starvation mode is a little bit different on GLP-1s versus not. We didn't see as many people starve themselves before GLP-1s because, quite frankly, it's extremely challenging to starve yourself. It's, you're fighting your body, which is very, very powerful and doing everything it can to get you to eat. GLP-1s, that's just not happening. It's one of the consequences of such a powerful appetite suppressant and craving reduction medication paired without the guidance of, what might happen and more importantly, how to prevent it. And that plays into earlier what we talked about with these medications being used incorrectly. So what do you do? Do you take more medications, right? I go live every single day and people ask me these questions all the time and I'm always quick to tell them, hey, I'm a DC, I can't give you medical advice, but here's what my providers think and here's how they operate. And so should you add more medications? What could you add? You could possibly add metformin. All right, well, let's look at that. So you're on the maxed out dose. So you're not losing weight anymore. You're not at your goal weight. And you add metformin. Could that trigger some more weight loss? Maybe. What is metformin doing? Lowering blood sugar. If blood sugar was still elevated at that maximum dose, which totally could be the case if you had some really bad insulin resistance prior, the maximum dose wasn't enough to bring it down, then yeah, you might still have elevated blood glucose levels and the addition of metformin could possibly help. Okay, great, blood sugar's lowered, but is that solving the problem, right? Well, what is the problem here? And if I really had to boil it down, and we're gonna really touch on these two things, you have both the metabolic downregulation, the starvation mode, which is more of a reaction of the body in response to starving yourself, which we talked about. But then we also have this other weird thing, which seems to be some sort of medication adaptation, some sort of medication resistance, a downregulation of the receptor sites, if you will. And I see this stuff literally just yesterday on my intro coaching call. I was losing weight at the 10 milligrams, my doctor bumped me up to 15 and I stopped losing weight. I mean, within a week. That I thought was fascinating. And I see all sorts of different flavors and versions of this. And so while I haven't, and I don't think there's any research done yet on the potential of GLP-1 medication-induced receptor site down regulation, AKA you're on too high of a dose for too long of a time and the receptors that would respond to the medication stop responding, right? Like, does that happen? And I actually saw some doctors, some obesity specialists comes to mind defending that, like that can't happen, you know, and he was so almost emotional over the concept. I'm like, you know, and that goes into the whole fallacy of because something can't be proven to be true doesn't make it not true, right? Really let that sink in. Because something has not been proven to be true does not mean that it still can't be true, right? That's very different than proving something to be false, okay? But the implications of assuming something is true, obviously, you know, in the practice of medicine, you got to be careful, right? You use your clinical judgment, practitioners, based off of the available data. They're not always in a nice, clean situation where there's no argument and it's very clear what to do, especially with a newer medicine like this, one that's exploding at the rate it is. And there's just much more conclusive datums that we need to, you know, establish and figure out. So until then, you got to make the best decisions possible off of the available data that we do have. And there are plenty of other well-documented situations where medication exposure over an extended period of time causes a down regulation, right? Doesn't work as well. So this is why naturopathic doctors are amazing at this, right? So they're prescribing physicians who adhere. They did not go to medical school, they went to naturopathic school. A lot of them are trained in this concept where they're looking at medications as a necessary piece of the equation, but just completely different approach on medications than standard Western medicine. As you guys know, standard Western medicine is just, for the most part, generally only concerned with symptomology and what sort of medication and or surgery can we do to address said symptomology, right? But very, very different with this naturopathic approach. And you know, myself as a DC, many holistic practitioners embody that sort of approach, and that's why I have that collaborative clinic where I work with my medical practitioners, so they're on the same page. And so we have this sort of GLP-1 reduction of effectiveness thing. And so this is also a potential issue that is going on. And truth be told, for you guys wondering and trying to make sense of it so far, yeah, I think it's either one or both of these scenarios that are impacting you currently where you're at on a medication near the larger doses of these GLP-1s and you're not losing weight anymore. Even if you're at your goal, halfway to your goal, it doesn't matter. We're still talking about the same thing. And of course, we are working our way to you know, the solution to this, but I want to give you guys enough context to kind of learn with me and understand the thought process here. So no, I don't think adding metformin would be the great solution, because now you have a reference point of what the real problem is. Same thing with adding phentermine. And I bring these up because this is what some doctors are doing. And patients tell me, well, my doctor added phentermine to spark the weight loss. And I'm like, oh my gosh, you know, let's add another appetite suppressant to the equation, one that has some very deleterious effects to the cardiovascular system in particular. But, you know, no. Starving yourself more is not the solution to starvation mode. You may trigger more weight loss, but you're only kicking the can down the road. And mind you, the can, for the sake of this analogy, it's getting bigger, it's getting heavier somehow. I don't know what kind of metaphorical example I can give you that would, like, why would the Coke can be getting bigger? I don't know. You get my point. We're kicking this can and this problem down the road. Starving yourself more to get weight loss and break a stall is only perpetuating the problem, making it bigger for you and much harder to deal with. So that's not good. And so no, we don't think any medication would be the right solution to this problem. So to better understand the solutions, we got to really dig deeper into these two problems that we talked about and the why, right? So the metabolic downregulation, you know, we briefly kind of went into it before just to really understand this. Starvation mode is a reaction from the body to keep you alive. It's a self-preservation survival instinct in response to a caloric restriction, a greater caloric restriction, usually over an extended period of time. And it always makes me laugh when people are like, look at true starvation mode people, right? Like when they're locked in a basement, for example, and you're not fed any food, you know, they're still losing weight. So starvation mode isn't true. I'm like, okay. Horrible example, right? Somebody's locked in a basement. Somebody's truly starving, because we have to be careful with the word starving. What do we mean by starving? Do we mean eating 0 calories? Do we mean eating 1,000 calories? Because I call 1,000 caloric intake still starving, but 0 is completely different. So, you know, we really should have different names. I don't know what we would call the situation in which somebody's, you know, locked in the basement without any food. That's I mean, hopefully we don't have to name that situation because it's not happening that often, but true starvation, maybe? Let's call it true starvation so that you guys can work with me here and understand this. Yeah, when you go into regular starvation mode, you're eating 1,000 calories. Remember, your average body is burning about, say, 2,000 calories a day, right? The average body is burning about 2,000 calories a day. So you decrease your intake to 1,000. That's a massive starvation situation. Eventually your metabolism slows down and now you're burning 1,000 to match your 1,000. And that's why weight loss stall happens. But in a true starvation mode, your metabolism cannot go down to 0 because you would die. So of course you keep losing weight, and it comes in chunks and spurs. It's not linear weight loss. Anybody will tell you that. Any weight loss, whether it's true starvation, or regular, is never linear, because your body does all sorts of crazy hormonally driven things to slow it down, to stop it, to shift to other mechanisms and energy systems and metabolic pathways. It's pretty wild. Anyways, I just had to share that with you. So starvation mode keeps you alive by slowing down your metabolism, in essence, right? This is what our ancestors had to do for millions of years in order to survive periods of famine. And then the other part of it is just a straight sort of resistance in your body, in your cells, that develops. And again, we see this with other medications. Exposure to a medication at a higher dose over a longer time, generally speaking, and it's like there's like a decreased effectiveness of that medication, which really I have no other explanation. If anybody watching this has a better explanation as to why that's happening, please let me know in the comments. I would love to chit chat with any clinician or go on any podcast with any pharmacist that can explain a different plausible, you know, sensical theory. These are all theories, right? We don't know. I mean, that could be causing the experience of the patient, like, it doesn't work anymore. I don't feel the control anymore. I don't feel the effects of it anymore. Even just that part, not even the isolated weight loss, just the isolated subjective experience by the patient to feel that it's working, right? The reduction in the food chatter primarily is what we're talking about. So we got these two things happening. We have a better understanding of why this is happening. And it's unfortunate that we have these cookie cutter templates out there where doctors every 4 weeks are just increase the dose every 4 weeks. I mean, that's literally what's happening. A lot of you guys can relate to this. You start off at 0.25 of tirzepatide, or 0.25 of semaglutide, 2.5 of tirzepatide, and then 4 weeks later, you bump it up to double the dose, right? So you double it at 4 weeks, and then you double it again at 4 more weeks. So 2.5 becomes 5, and then 5 I've seen some people go to 7.5, go to 10, and then 10 might go to 12.5 or 15, right? And then you're at the max, right? So these echelons of doubling the dose very quickly would get somebody to damn near the maxed out dose. And, you know, standard practice of medicine would be, if I see a patient is responding really good at a lower dose, we would stop, right? But that's not happening right now. Many people are just working with a doctor, working with a clinic, where they're just willy-nilly increasing these doses. And I know this because I coach thousands of people on GLP-1s, so I'm talking to them every single day, and I'm reading all the comments and all the communications, and I'm on the Zoom calls several hours a week in one-on-one, small group, large group format. So I've learned a lot and patient experience to these medications. This is rather unfortunate that it's happening like this. I definitely want to share with you why I think it's happening like this. You know, did doctors all of a sudden forget how to practice medicine? No, I don't think that's the issue. But before we even get into that sort of societal problem, why are the ones that are practicing good medicine still gravitating towards this protocol, right? Well, that's what the research shows, right? The clinical trials, right? We got to follow these clinical trials. These clinical trials were done, and they show that for efficacious continual weight loss, the best results were shown following these protocols, doubling your dose every 4 weeks. Okay, so what can we conclude from that? Does that mean everybody should follow this protocol? Right? So I made a response to this doctor on TikTok, actually, talking about this very thing. And it was great because there was no criticalness. We weren't trying to clickbait. I really had a disagreement with his comment that he made. And I thought it was important to mention that. And, you know, he responded regarding dosing, right? Because he literally was talking about increasing everybody's dose. And so, you know, he talked about doing that because people shouldn't have to suffer for staying at a lower dose because their doctor won't increase them. And I agree with that. Hopefully nobody would have to suffer and not get the higher dose they need. But, you know, when he mentioned we're not in a position to have any arbitrary protocols that we can just sort of make up on our own. And I thought that was phenomenal. I thought I agreed with his concept, and, you know, it helped me kind of look at it from his perspective. But then I kind of take a step back and go, okay, well, again, and I mentioned this earlier, available research, you have these protocols. These protocols show efficacious weight loss and tolerable side effects, right? I mean, you know, we all know how we feel about the tolerable side effects. I wouldn't call them tolerable by any means, but, you know, they're not killing people, right? And so whatever constitutes FDA approval, right? They're safe enough and tolerable enough. And end of my little facetious underlying opinion without saying it directly. But nonetheless, they are FDA approved, right? But do we really need literature done on utilizing these medications in a slower protocol, titrating up slower, titrating up at lower increments? Do we really need research to tell us that's okay if we're talking about weight management? Think about it for a second. We're not talking about diabetes here, because we know all too well the deleterious effects of letting someone's blood sugar rise out of control. You stabilize that immediately for immediate health control. But when it comes to weight management, you guys were, no offense, overweight before you started the medications. You know, you're not keeling over today or tomorrow because of your weight issue. Now, some of you are, and that's another conversation if you're that obese. But for everybody else, working your way towards that, trying to fight it, you're not there yet. And so we're talking about a real situation here. And again, you take a step back and look at the practice of medicine, and I'd argue, even as a DC myself, just understanding what medical practice, having worked with them for my entire career, I think most would agree with me that the premise is to, in addition to do no harm, do the best that you can, minimize risks, look at the most important thing, right? That we need to do to keep the patient alive and healthy. And so sometimes you have to make decisions outside of research telling you this is how you do it. And you look at available data and do best clinical judgment. And so clinical judgment would tell me that I would much rather keep an overweight person and titrate them slower, and this is how my medical practitioners agree too as well. What's the worst that could happen if they stayed on a lower dose and quote unquote suffered? But if they're suffering now on a lower dose, weren't they suffering even more before they started the medication, right? But wouldn't that be, like, what risk are we worried about when we compare it to the risk of accidentally moving somebody up too quickly? There's a ton of risk with moving up somebody too quickly. Nausea, diarrhea, vomiting, poopy pants, pancreatitis, gallstones. I mean, all these are rare complications now when we get into the gallstones, biliary disease, and pancreatitis, but they're still real complications. But even aside from the real complications that are rare, even at higher doses, we got the side effects that are just, you know, and I go back to my underlying kind of hidden message earlier about them being FDA approved. They're still shitty, you know? No pun intended there too as well, but yeah, they're awful. And so why are we concerned about going slower if that means we could minimize the potential risk of slamming somebody with side effects? Because what if we can get them to respond at a lower dose? And we're gonna get into all that. We're gonna make sense of how we can make a lower dose more effective as we, you know, continue on this video. But I wanted to paint that picture. I wanted you guys to understand that and get a get a reference point to that because I think it's very valuable. Remember that the literature that was done, the narrative behind the literature is that obesity is a chronic irreversible disease, and so it's going to require medication for the rest of your life like many other diseases. And so that narrative went into the concept of the program design and the research that wasn't done. They weren't looking at figuring out if we could do lower doses. No, they were looking at, well, how do we keep the weight loss rolling? And that's what they did, and that's what they demonstrated. And so you can't use that when you have an alternative motive, right? Which is helping people utilize the lowest doses possible and still handle the problem in front of us. And so while these individuals were doing some lifestyle interventions, the type of lifestyles they were doing, as you could possibly imagine, were nowhere near the degree and extent which me and many other functional practitioners believe should be the standard, right? Some regular intermittent fasting, some solid hypertrophy style weight training, eating less processed foods, eating lower carbohydrates, not for life, but for at least a certain amount of months to become more insulin sensitive, following a good supplement regimen, optimizing your stress levels and optimizing your sleep, reducing inflammation, balancing your hormones. All of these things can make a huge impact. And we know that standard lifestyle, when they look at these researchers with these research studies designed, they're not doing anywhere near that. And so, of course, that's why the results every 4 weeks, you need to increase the dose. It's almost as if, right? Because here's another observation. Why is it that you guys have heard of microdosing, right? Very, very popular, sort of becoming more popular, utilizing lower doses than even the standard dose. I can't tell you how many people went in a microdose like, I feel nothing. Well, of course you're gonna feel nothing on a microdose when you start off because you're metabolically busted. You're inflamed, you're insulin resistant. A microdose ain't gonna do shit. Yeah, it is doing some stuff in the background, but as far as your food chatter, you gotta be actually metabolically sound. You have to be improved for you to actually really benefit from a microdose. You gotta work up to that. So why is it that people that are more metabolically busted need a larger dose? Maybe there's something to that too as well, which really kind of resonates with the direction that I'm heading. If you couldn't figure this out, is the way that we can make lower doses more effective is by targeted lifestyle interventions done at the same time or even before to sort of prepare the body and almost, if you can say this, allow the receptor sites to be more responsive, or just maybe that's not happening and maybe it's just a combination of doing other things that also target insulin resistance and inflammation. So we have two things, right? Like GLP-1s shouldn't be a monotherapy. You know, GLP-1s are doing their things with the inflammation and the insulin resistance, and you have your other lifestyles also. So it's a combined and collaborative effort between these different treatment options, right? I think it's probably that one, right? But you know, we have so much to learn and figure out. But getting back to the problem in healthcare right now, well, there's many problems in healthcare, but right now with GLP-1 medications, with the explosion of GLP-1s and the big money-making opportunities for clinics all across the country, you just have too many people right now getting these medications from med spas, from doctors that don't do much with weight loss, if any at all. And you know, so there's no coaching, there's no guidance, there's no structure, there's no support. Here's your med. And when you don't have the training and understanding of how weight loss, like what even promotes weight gain and weight loss resistance and, you know, metabolic health, if you don't understand that, you certainly aren't coaching your patients in that. And what are you gonna default with that limited understanding is the cookie cutter templates, because that would be your safest play, right? And so it's a very logical situation right now that we find ourselves in and what's actually happening. I know people that are working with some very good obesity specialists, and while I disagree with the premise that many obesity specialists agree in, which is obesity is a chronic irreversible disease, what I do love about them is they do understand the implications of these other lifestyle interventions and how much they can help. And so they're usually doing a way better job because they're actually spending the time that the patient would need to get them to understand these other aspects. But for everybody else, the majority, because there's not that many obesity specialists, for the majority of the world, they're kind of screwed, you know? And at least the ones that we've been able to get into our program and help have certainly come to resolution. And I'll be sharing that with you here briefly, but I just wanted you guys to really get an understanding of the current scene. All right, so what do you do, right? And so I can only share with you what my providers do as far as the medications and what I do as far as the coaching. But the premise is simple. When you're in our program, especially when you start off in a situation like this, we need to develop sensitivity to the medications, right? So we gotta fix that resistance situation that seems to be going on. We need to fix the weight loss plateau, right? And I've made a ton of other videos where I talk about the weight loss plateau and how we approach that, right? So just briefly, and I'll link to it in the description too as well. But basically, we put them on a reverse diet or a metabolic reset. We establish how many calories they've been eating. Say we find out they're averaging about 1,000, and then we slowly increase their calories by about 200-ish every single week. And then we're looking for confirmation, right? Because we're essentially trying to get the body out of starvation mode, and what got it into starvation mode was decreasing your calories over that extended period of time. So we really just got to do the opposite and increase your calories, put you into a caloric surplus over time. It's a process, it takes time. So usually anywhere between 3 to 6 weeks, depending on how severe the restriction has been. But then it's really cool because you would think weight gain would happen with this, and that's actually what happens if you do it incorrectly or too fast. But when you do it this way, you're giving the metabolism time to actually increase to match the increase in consumption. And you notice things like my energy levels increase, my brain fog decreases, I'm pooping better, I'm less constipated, right? Like you're coming out of zombie mode, right? Because you should have never been in zombie mode to begin with. And so this is really, really powerful. This is really, really important to understand. So that's the solution to the weight loss plateau, right? And that might be the only thing we need to do with an individual. But sometimes in other situations, there actually needs to be this medication reset, if you will. And so if that needs to happen, then we're looking at, okay, let's do one at a time here, right? So we finish the metabolic reset if that needed to be done. They're stable. Then we're implementing those pillars of lasting weight loss with the FLOA protocol while my medical practitioners are slowly decreasing their dose. So you're decreasing dose. Just like the reset, if you increase your intake too fast, it's too dramatic of a shift, you gain weight. If you decrease your medication too fast, you're probably gonna gain weight too, right? Even though you're not feeling much of it right now, it's still doing something, likely. And so you decrease the dose slowly, tirzepatide, maybe 2.5 to 5 milligrams a week, just kind of depending. And week by week, maybe 1 to 2 weeks at a time per shift, but you're replacing the medication with lifestyle, right? The FLOA protocol is what we've created, and that stands for fasting like our ancestors, spelled FLOA, pronounced flow, and there's many pieces to it, right? The approach towards diet is an anti-processed food diet with a ketogenic twist, and then we're doing lots of fasting, getting our patients into deep weekly rounds of fasting, closer to 48 hours per week, getting them on weight training and yada, yada, yada. So we're working these lifestyle things in, and again, I see this happen all the time. We see, for the most part, people stay pretty stable. They're decreasing the dose, they're staying stable. Nothing dramatic is happening. Every now and then, some stuff happens and they need to slow down, they need to decrease slower. Okay, great, right? If you start gaining weight. But for the most part, people are always shocked to see what happens when they completely wean off, and now they have a lot of these lifestyle ins that I coach them in, and they feel really good. They're not losing massive weight. You're not losing massive weight as you decrease your GLP-1. Sometimes it happens, and sometimes you gain a little bit, right? All across the board. But for the most part, it's this reignited excitement because it's like a fresh start and you're resensitive. 2 to 3 weeks off the medications. But I also think it's not just being off the medication is the most important aspect to resensitize, right? If that's actually what's happening here, the desensitization to begin with, the resistance. But I also think it's the reductions in inflammations, the balancing of hormones, all the other things that we do to their health, put the body into a better and op state to allow the healing to take place. Because I've seen people on shorter periods of break seem to come back and respond really well, and sometimes they don't. It's just, again, it's all across the board, but I'm definitely noticing a connection between better lifestyle choices producing more favorable outcomes in this scenario of utilizing a lower dose again. So then eventually the practitioners get them back on a lower dose and they feel really good. And then it's kind of like starting my program from the beginning, where the philosophy is keeping them on the lowest dose possible and continuing to make progress with reductions in fat, reductions in visceral fat, improving muscle mass if we're closer to the body weight goal, and just continuing overall down that path. And they are almost always blown away at the fact that they don't need nearly as much medication as they did before. That's always interesting. And so it really is that simple. You don't need to overcomplicate it. Look, if you guys want to work with us, put a link in the show notes so that you guys can reach out to us. We do service all 50 states and I can coach you guys globally. But if you are working with a provider already, your insurance covers it, I encourage you to take advantage of that opportunity as much as possible. You can still get the coaching from us. But if you're not in that situation where you can and you do need to figure this out with your own, get into communication with your doctors, get in communication to your prescribers, because, well, it really just depends on your provider's viewpoint and the situation you're in. But it starts there. I think if you start it there and you make that attempt, there should be a reasonable shot that you should be able to get this done and be your own advocate. That's the reality. You know, the reality is, guys, you have to be your own advocate for healthcare. You have to be your own advocate and take responsibility for your health, because nobody else will. Nobody else will. You have to be the one that goes above and beyond to ensure that you're getting the best possible care that you can. Remember that our healthcare system, unfortunately, and to no ill will to any doctors, it ain't their fault. You know, doctors are victims of a shitty healthcare system that makes it extremely difficult for them to do anything other than just get them in really quickly, make sure their medication doses are correct so they don't freaking have extreme issues, and that's it. No coaching, no guidance, no structure. You know, there's no preventative healthcare. And you guys are gonna have to go out of your way to do that. And I really encourage you guys to consider getting into our communities. You know, we do have, you know, yours truly is gonna help you guys achieve a better life and a better level of health wherever you're at. Whether you're coming to us in that obese state with no other options, or whether you're coming to us already pretty dang healthy, but you wanna optimize, this is gonna be the right community for you. So if you guys enjoyed this video, check this one out over here. This one is where I took a deep dive into exactly how we utilize the peptides and the GLP-1 medications in combination with the coaching. Keep it locked and loaded, guys, and we'll see you later.